Hello to everyone. We are at the beginning of the afternoon period. I hope you had a good lunch. And now it's not time for nap time. Now we're going to be thinking about the next pandemic and the preparation of France on the subject. The question is the next pandemic. Is France prepared? What kind of pandemic is one question. Also, the period where we have all these different geopolitical events, which are very worrisome. France, is it prepared? And to be prepared, what does that mean in terms of organization, in terms of information system, financial system, and population? Prevention issues. And is France ready? Is it prepared? Is France resilient? Is it not ready? In that case, what should be done? Thank you all three of you for being here. And I would like Franck I will raise this question. Following this pandemic, COVID-19, what are the advances we had in the area of cooperation, in the different research areas that you have observed, which should be highlighted? Thank you very much. Obviously, the different institutions did not stop. They are anticipating. There in the US, they were spoken about an example of anticipation. And in Europe, also Iraq, we have this preparation measure to prepare the stock inventory, to have different measurements so we can adapt, have anticipation, monitoring. We have this momentum, this dynamic situation. All of this can be rolled out for these different institutions. We have international organizations that have priority in this area. The role of WHO as a coordinator at the international level is very present, even if they have limited resources. I would like to talk about the French territory. We have different initiatives. We've had the different bodies, INSERM, about international organizations. We had Pasteur as well. This network internationally is working on the preparation. And we had major challenges, which is monitoring and to identify each time the starting off. We know what are the big groups of viruses that can emerge and reemerge. And we do know today that we have different countries that are intermediaries, and they have critical zones where we can have a reemergence of epidemics in sub-Saharan Africa, for example, and Southeast Asia as well. All of these different aspects are confronted with this big challenge, and the U.S. is withdrawing from their support. So we have a real challenge to set up these measures. You also know each time we have an earthquake, for example, we try to identify as early as possible the different location. For example, we want to see, is this a nuclear attack, for example? For pandemics, we also, with the social media, all the data is circulating when we want to identify where an epidemic is starting off, and we're doing quite well in that area. And then all of these different technologies, early warning systems, which all are very important, because in these different countries,
au plus proche de ces endroits-là. Donc ça fait partie de ce qui est en train d'être mené sur le renfort des coopérations internationales. Après, vous avez sans doute entendu parler aussi d'une stratégie 100 jours, c'est-à-dire la promesse de dire...
In fact, we have the promises. Once you have a different signal, then we have X amount of days to respond. We have the capacity to have the vaccines, diagnostic tools. We have to have this integrated tool. And in this France, we have a program that's very efficient. And so for the vaccination programs that we have set up are quite efficient. And this helps us the capacity to have applicants for vaccines. We have different viral families that we have identified. And this is really this is very important. So after, and then one of the major subjects is the adaptability. This has been mentioned. We have this complete documentation concerning the different vaccination campaigns in France. For the flu, for example, where we have the different adaptability, vaccination for the flu, for example, as compared to other European countries. And so we also have this biological immunity, which is very important for these different anticipation aspects, vaccination that has to be set up. We also have a big problem of this herd issues, immunity. So we have Doliprane, for example, all this information in this area which destabilizes the capacity of our population, specifically in France, for example, we're very exposed, and also the different most disadvantaged population. We know these are the ones that are most exposed to the risk for these kinds of pathologies. So we have a real subject about the adaptability, and we see one of the different issues and problems in this area is we have to trust the health system really has this issue, which is the confidence, trust. There is a distrust in scientific experts, and so when we get closer to the public authorities, we see that the people, our citizens, have less confidence. So confidence and trust is very important in considering our capacity. I would like to mention this because we're not very far from Switzerland. What happened in December 2024, there was a proposal to have in the Constitution, anchored in the Constitution, the integral protective of this system to avoid these kinds of flus that are recurrent. So we work in France on these issues, and I want to get close as possible to the population. It's important to prepare for these kinds of issues. Mental health also is something important, and other metabolic diseases, and also we have these different stroke issues that are related, and all of this is important to analyze this carefully.
Merci, Franck.
Just in a few words. Thank you, Franck. Maybe we can have a reaction on this subject as well. Two questions. What have we learned from these crises in the organizational areas? We have progressed in the anticipation of these pandemics, and what you've just explained, and this triggers off this, what are the different obstacles? Have we progressed or have we regressed? What are the ways we can better prepare and better prepare our citizens for this possibility of an unpredictable epidemic? Thank you very much. To bounce back on what we've just heard from Frank, there are different elements that have progressed in the different, all the different inventory of measures we can take. But in the area of the cultural area, I believe, we have regressed, not progressed, in other words. We have Philippe Joubin who says that. Now, if I look at what are the different acceptability to take the risk when we're in politics, you need to have transparency. You have to sometimes say, I don't know. Today, I'm not sure that everyone really refers to what Edouard Philippe says. Many viewers say they don't know. We need to accept errors as well. We can say we made mistakes and in the past, and we made mistakes because in the meantime, we have not actually solidified our position. When we can have any crisis, we will also make mistakes in the future. And it is exactly the rule. It's the same thing in all different sectors. We can make mistakes. And we have this enormous area above facing us. And it's not a reassuring situation. We have to have a democratic deliberation, communication during a crisis. What the members of parliament, for example, the different elected officials, what should be the communication message. And when we hesitate, I'm going to, for example, will I just see a parliamentary member of parliament when I'm sure about something? In fact, we like to repeat, we have to be transparent in our communication. Otherwise, things will not happen well. Psychological issues are important, especially in our country. There will be deaths. We cannot avoid that. We're in a country where we have to point our finger to a guilty person responsible. So we have to have guilty parties in our country. That's the way we think. This is a cultural subject that is major. And also, concerning this issue, and Franck was talking about this, the next pandemics will be threats to democracy. They were. Remember when we had the COVID, for a certain time, all of a sudden, at the right and the left, there was fascination for China. The Chinese, they were talking about them, the people were demonstrating, they were contaminated. Okay, this is what we should do, they said. And this is not just an anecdote. There were papers explaining there are certain countries that are not democratic or coping better. And also in the different figures, democracies actually coped better when, as compared to the authoritarian countries. Now, if there's a pandemic, before we have deaths, but before we have the different, those who are against democracy, they are there, and they're going to benefit and use this. And before we have the different Russian tanks, for example, coming to Paris, they will be using these different situations to their advantage. And we have to force the system to, we need to work together. The health system has to work with all the different actors. And I'm trying to speak very quickly. We won't be doing a fantastic planning. When I was working when the pandemic started, and there were the first weak signals, and we've heard from Agnès Buzyn today, and we had the minister communicating early on, in fact. But the plan that I came with as a military is the first victim of the war. But however, if we have one day ahead of time, then we have one extra day, and we have to remember that the virus is evolving all the time. And the 2nd April 2020, at the peak, we didn't have one single bed available in France. So at the beginning, a month and a half before, when we started doing something about the beds, it was in the plan. And so this was a very important step. I have 2 points that I like to use conclusion. And the paradox I would like to cite is that we have the feeling that the pandemic is the helicopters, transportation of planes for our patients, but with the first issue is to look at are the first most vulnerable people. I say this, those who have died, they were overweight, they were poor, they had poor housing. Those are the ones that died first. These are factors that prevention can change things. So this is a sentence, it is better to have a pandemic to hit a population that's in good health because they can resist better. So prevention is the icing on the cake that we do. We would do this. It's very important to remember this. The last point, which is a transition with all the grace given to me from Marianne, the next pandemic, because this morning when I was thinking about this subject from Blanche-Côte, we have this debt we heard about, Social Security is in deficit, but the next pandemic, the private actors, how are they preparing? How will you ensure? Is it always still the state, the households during the pandemic? What happened to them? How we cannot stay in the system where we say the state is the last recourse insurer for everything that can happen. Well, whatever, as we say, the topic, whatever health care takes, that's our topic. But in the model for development, all the different private actors, regardless of their size, they say the pandemic can be an opportunity to sell vaccinations, but we have to see what we can how we can handle this with our staff. It's not the state that can do everything. The state cannot do that. And we need to socialize more the taking over these different risks. The state and Social Security and the last recourse insurer cannot take up this completely. I don't know if I answered the question. Not bad, not bad. But this is what I wanted to say. And it makes me feel good to say that. With a lot of words, when we're a former minister, we can speak more, and people are very polite, so that's good. That really made me feel good to say all that. Well, also that it was important to hear different words like hybrid, prevention, interaction with the democratic countries, with the other countries, and this is the title. Which is healthcare for whatever it takes. We do feel and we see in this epic era we're in, gives me these two questions I'd like to ask Marianne. Is there a way of working in the area of prevention so we can anticipate and have priorities? Because it's important to have different priorities for actions so that we can have a population in a better health if and when there's a pandemic. So this could be something that's very important. What are the ways we can mobilize so there will be less cost? It's true today the deficit of the health insurance is really has this debt issues, and so we are facing these financial issues today. Yes, in fact, concerning the different financial challenges that are really the heart of the pandemic, with the lots of expenses that were quite high. So what are the ways we anticipate, and how do we anticipate? Aurélien was talking about prevention. It's always, this is the poor partner in our models, but prevention, okay, we have financial issues, education, all of them are very important, as important as the financial aspect. If tomorrow we have a crisis, how can we face it? Probably we'll have less effects than we had in 2020 because we had this surprise situation in 2020 with the COVID-19. And so we were going to spend whatever it took in 2020. And we was not always just perfectly controlled. And also fraud issues occurred. So we look at the 48 billion in health insurance, and also from the amounts from the government has a period of 3 years. So the public funds happen because we had these issues because we couldn't anticipate, and also that we had the development of remote working, telework. So all of this and all part-time work, which represented some 30 billion euros with public funding. And we heard this morning at the level of the public debt as percent of the 50% of the GDP. So the interest rates were during COVID, they were negative. And so it's different today. So the situation, if we would have a crisis today, would be very different than in the past. So this is the challenge. So the anticipation, organization are important to limit health expenditures. Also challenges with the use of data, effective use of data to be anticipating evaluations. We have different progress since 2020 in this area. And investments are important so that we can progress and we would target better the financing. We would have the different lessons that we learned from the COVID crises. We had different elements and the financing took too long. So when we're at the peak of a crisis, for example, there would not be many alternatives because we had the level of debt. It's one issue, and we have social security issues. However, in these kinds of crises, to have a good economic fabric and to have different actors who are ready. This is important so that we can accentuate other levers. We've heard about the different level of savings from citizens, which has increased by 19% on the average of French people. It's one of the most important rates in Europe. 6 billion savings. How do we use this? There's some false good ideas. We have what we call the Livret A savings account. This is not a good idea because the characteristics of this Livret A, which is a guarantee of capital, and the fact that we need to have this availability funds right away. And so this liquidity and this guarantee of capital is very important. So we could have the collection be correspond to the level of investments. To target the Livret A is not a good idea. So other federations were proposing that. However, the Livret A, it can be very useful in mutualizing, pulling together all the different funds from the Livret A. So we have this 60% of the Livret A is managed by the Caisse des Dépôts, and with this managed by the Caisse des Dépôts, part will be financing loans and others assets. So this health sector is one of the beneficiaries of this Livret A, with this pooling of resources, mutualization of the different uses to finance hospitals, health centers, investments in health. We can do even much more, taking into consideration the different aging of population issues. We've heard about this 25 billion program with the Caisse des Dépôts, with also the post office, so that we can have these funds earmarked. So also health insurance, this is the #1 savings with 2 million, and also been debates concerning defense. We have to have the same level of health, so we can have life insurance that we take into consideration, and they can help the private actors for this finding. So there are other ideas that we need sovereign ones, because of crisis, we do have this enormous sovereignty issues, so that we should be able to develop therapeutic, technological, digital research, and the production of drugs in our territory. All of this is to have investors that are sovereign, savings of French people. It's not the only avenue. There's different health actors that are involved, and we can consider that the health system is not as prescriptive enough in the international context that we know to oblige incentives in this area. We only have a few minutes left. I would like each one of you, in a few words, because I've understood things are prepared, things are anticipated, other things are not yet known, unpredictable. As a federation, we didn't have any meeting concerning this crisis. We don't have any meetings to prepare for a future unpredictable pandemic. We don't have any mobilization in our federation for this. For each one of you, what would we need to do? One sentence, please, because the time is going. How could we better prepare France if we have this unpredictable pandemic? We're sure which will actually happen. Okay, reduce public debt. We said this today. This is really preliminary. If we don't do anything, then the debt load, which is 100 billion public debt, it has to be resolved. We need to handle this, because otherwise we cannot confront. We need structural reforms. We heard also, we spoke about the pension, unemployment insurance. All of these have to be really looked at carefully. Franck, I would say education in the health area is very important, and we spoke about the different problems. And for me, the citizens and the insurers have the investors, they have an important role to play, and in the area of health. And we don't have we have shortages in this area. We heard different businesses from the different roundtables. We have problems in financing because we cannot mobilize the savings of the French citizens. We need to have incentives for this. This is really what I would like to say. We have the different stakeholders, citizens, and the mobilisation of savings. That's very important.
On a essayé de faire des phrases parce que le truc avec les mots, on a trouvé que c'était trop compliqué.
We said we're trying to do sentences, so not just words.
Donc, non, moi je pense que il faut faire le pari de la confiance.
We have to have trust. Our citizens are intelligent. We can say, even when we don't know them, and so if we have to give them the keys, otherwise in transparent communication, trust is very important. This is not always being in a suspicious state. François Braun, who is the Minister of Health, fighting to buy Befort-Sus in 2023. Nobody knew they would have the authorization. He was fighting for this. And so this, actually, the Brocoli epidemics were actually able to be treated thanks to this. So we have it's very important decision-making and confidence, trust, less suspicion, and not call that we have complotists. We have a lot of citizens who think the scientific truth is something related to domination. We have to work in that area because we have to reverse this because there's some suspicion, and so we have to do something about that. Thank you all, and so we have to fight against this kind of conspiracy. I would like to thank you all and wish you a very good afternoon.